what does stress truly do to our body?
Fight, flight, fright. Chronic stress will raise both cortisol and insulin. When you keep on hammering on these hormone receptors, the system can start to break down.
So, because there's a lot of fear mongering around diabetes, right? What is the actual cause of diabetes?
It's a lifestyle disease. The cause is your body has stopped making insulin. You can give healthy people pre-diabetes in 4 days by cutting sleep. It's a big problem to not pay attention to this.
Now, with so many avenues opened up, be it Instagram, social media, porn addiction, alcohol, and a lot of it, people have way too many things to use to numb themselves. Do you think that there should be equal number of therapists as many number of surgeons?
Yes, everybody might be having their own purpose on earth, why they're here. We have to help people with negative emotion. You can influence the body through the mind and the mind through the body, both.
Have you ever seen a case where someone's spiritual growth triggered physical healing without a single prescription?
I've seen people's allergies go away, migraines getting better. We were trained to call it psychosomatic.
Yes.
I don't want to use that word, but maybe psycho, neuro, immuno, endocrinology. Thoughts, feelings, emotions, hormones, it's all connected.
We shot an amazing podcast with Dr. Roshani, and the theme of the podcast was freedom. Freedom from over-medication, freedom from the old, outdated beliefs about your body and chronic illness. It's very rare to find a medical doctor who also understands the healing side of the body, right? Who understands subconscious beliefs and how our trauma is still affecting our body. And throughout the episode, it was so brilliant to see how she was breaking all the myths, helping us understand what is truly diabetes and how it is affecting our body and what are the lifestyle changes we need to do and how it is truly possible for us to reverse this. And also being an endocrinologist, she talks about hormones and how it affects our body, start to end. And it's so refreshing to see a doctor talk about how the pharma industries are getting benefited from prescribing the medicines to us. Please watch this entire podcast with your family to understand your body better and make sure your entire family lives a happy and a healthy life. I love how you believe in healing and empowering the patient and not just treating the symptoms. What do you actually mean by that?
So I've always had this educator bent, like somehow teaching feels more natural to me than just prescribing. And one of the things that happened was in 2011, we were planning to move from the US to India. And I was already an endocrinologist at that point. So we've reached up top of the ladder as far as professional degrees. You've that's the highest degree possible in diabetes and hormones. And I was practicing, everything was fine. We were moving to India. And what normally happens in endocrinology is you write the medicine and then you also prescribe education. And that is done by the diabetes educator. So in the US, that was somebody else and the patient would go for that class. As I was moving to India, I thought I should hear what is this educator saying to the patient because something important must be getting discussed over there. No? I'm writing medicine in 5 minutes. Those are 30-minute classes about diabetes. So I started listening. I sat and I attended those classes. And I was like, this is important. What they're teaching is the lifestyle aspect. And I'm just giving the medicine. But a lifestyle disease, type 2 diabetes is a lifestyle disease. So I thought if I move to India like this, without knowing how to be a diabetes educator, then what the doctor-patient relationship is called is compliance. The patient must comply with my advice. So in the US, the word is non-compliant patient. Or in India, uncooperative patient.
Okay.
These are words in our doctor societies, which basically says patient is not interested to change. But that's so bad to say that about a patient. Why would they come to you and pay fees and wait in the queue and spend hours and half of the day if all they want to do is come and sit and not listen and not cooperate? I mean, it's their health. So somehow I was not liking this idea that doctors are telling the patient to do what the doctor says. So I decided to become a diabetes educator before moving from the US to India. And in learning that course, there were 2 columns and it said, you can either be in the patient compliance model or the patient empowerment model.
Okay.
Immediately my eyes opened.
Okay.
Obviously, I want the empowerment model. It's no fun pushing the patient, forcing them do this, do this. Why don't we empower them with information? When they feel right, they will move in that direction. They will make better choices or make more informed choices. And it's more fun for the patient rather than us making them feel bad. And the emotional charge of it should not be of guilt, shame, blame. They're coming into the doctor's office to feel better, I hope, right? Not to be yelled at and scolded. So, empowerment means yes, I see you. I know you want to be healthy. Do you realize that this is getting in the way of your goals? Did you know, for example, did you know that this food habit is raising your glucose? And then you're coming to me and I have to write the medicine. Do you want more medicine or do you want to change the habit? If only you knew that, maybe you would change the habit. That's an empowering approach. And just I felt happier.
Okay.
So I did it because it made me feel happier. And just the rule of life is what you're feeling is probably what the other person is also going to feel. So it just became less tense.
And you were also quite interested in behavioral understanding and behavioral science. Why was that so crucial? Because I don't see personally a lot of doctors, because you also spoke to me about Reiki and how it helped you, right? I don't see a lot of doctors talk about this. They're majorly about medicines and science, wherein there is not a lot of scientific proof for Reiki or pranic healing or anything which is considered alternative. So, how do you balance both, and how is behavior, understanding a patient's behavior or human behavior, crucial in this?
Fully connected, right? So being aware of the person's behavior for my world is directly translates to outcomes in my space. But the foundation for this, how I got curious in this, started in my teens. There were two patients in my life when I was not even a medical student. I was in school. One was my own grandmother. She had a diagnosis of breast cancer, fought it, gave birth to my dad after that.
Okay.
So I wouldn't have been here had she succumbed to cancer in her young age.
Okay.
Lived 40, 50 more years or something, long life after that. And kind of like her attitude back then, even cancer therapies were probably not so evolved. They were very toxic therapies even then. She kind of had this attitude of, I don't have time for cancer. I've got young children to raise. I have a family. I need to be there. And she just fought her way through. And it was a very gritty attitude she took towards it. And everybody in the family's always looked up to that fact that she overcame cancer back then. Simultaneously, a few years later, while she was in remission, a very close person in my life came down with prostate cancer and succumbed within just a few years. And I was like, oh my God. So I don't know. It just somehow it sparked me that what might be happening. And I saw his mental approach to his cancer. He was kind of shattered. It's a very devastating diagnosis. And he just couldn't come out of the negative space in his head. Not to blame a patient, right? This is not to blame a patient. It is a devastation. And some cancers cannot be won. But I just got curious that what role does the mind play in healing or disease? So behavior and the mind is together linked with the body. So in fact, I actually applied for specializing in psychiatry first. So I did a year of psychiatry training before switching out back into internal medicine, all the while promising to myself that I will remain connected to behavioral medicine. So long story short, I became an endocrinologist, hormone specialist. Hormones go through the entire body. They respond to emotions. So when you feel negative emotions or stress hormones, we all know that causes a hormone surge. So behaviors, emotions, thoughts, hormones, it's all connected. There's no way of separating out. So for me, behavior space was an extremely powerful space because it was always mind-body. You can influence the body through the mind and the mind through the body, both.
Yeah. And how do our hormones kind of change our behavior?
So, being women will a lot of times say, right, that, oh, in my this time of the month, I'm feeling different. And genuinely, when female hormones are on the low end, when the estrogen is on the low end, you can have a low mood. So your hormones do affect how you feel. If your cortisol is too high for too long, stress hormone is pounding, pounding, pounding. It can lead to depression.
Okay.
So you can, yeah.
So in our cycle, there is a part of a cycle where estrogen is low. So physiologically and naturally, it is supposed to be low. So are we doing something against it? in our day-to-day life?
So I guess now in modern days, this is like the question of abundance, right? Is like, should I rest or should I? Because
Yeah.
if we rewind back so many centuries when there was no comfort, we had all challenges. We were out in the wild, no safety. We were on the go. Probably then the female hunter gatherer didn't maybe have the luxury of saying, "Oh, I'm on my period and now the tiger has come, but I'm not feeling up for it. Like, please come later." So you had to sort of respond to the challenges in the natural environment regardless of where you were in your monthly cycle.
Right.
But still now, since we have options, we have the ability. Thankfully, there's no tiger chasing us anymore. The roof is stable over our head. We're not worried about the next meal, hopefully. We can listen to the body. If I'm not feeling up to it, it's okay, right? Why not listen to the body? Why do we need to fight with what the body is saying? Now, some women might be more sensitive to it. I know I've had phases in life where my premenstrual time was smooth. There have been times when it's not been smooth. So I think your body changes over time. What's happening in your life, maybe your environment stressors, so many things might be going on that make us maybe more vulnerable. Can you take care of some of that so you feel more resilient? You don't feel so down all the time.
And what does stress truly do to our body?
So acute stress is okay. We are designed to handle acute stress.
What is acute stress?
So a tiger chasing you. Okay, a fast. You have to run and climb up the mountain. Suddenly you have to have this burst of energy and you quickly escape out from danger, right? Fight, flight, fright. In acute situations, stress is okay because the stress response is life-saving. Now the fight, flight, fright, if I use the tiger example, if it's that boss or it's that promotion or it's that relative or that neighbor that's causing me chronic stress now, the irritant is not going away, I'm now stewing in stress hormones. And especially, we always talk about cortisol, but there are so many hormones. Like for me, even insulin matters a lot. Chronic stress will raise both cortisol and insulin, which when you keep on hammering on these hormone receptors, then the system can start to break down. And chronic stress can be linked to so many diseases. You ask any specialist doctor how much of their daily practice is worsened by stress, they'll say a very large percent.
So now, is it truly about what is happening on the outside that is creating stress? Or is it our perception of what is happening on the outside that is truly creating stress?
Okay, so Vedant, right? So for me, Vedantic answer to this would be an experience it's a mathematical equation actually.
Okay.
Experience is equal to the sum of the experiencer and what is being experienced.
Okay.
So I'm holding this hot cup of coffee. It's feeling warm in my hand. So the experience of warmth in my hand is me feeling this hot coffee. The coffee is being experienced by me. Now, if I'm stressed about it, I can't change the coffee. So the only thing in my hand is my response to the stress. Now, if it's too hot, I put it down. I can't make the coffee do what I want it to be. Right? I have to accept, right now it's hot. So I will put it and let it do its cool down process, which is natural. But can I accept that this is hot right now? Can I be in acceptance that right now this is hot? Why is it hot? That the experience, if it's negative, that's probably my reaction to the experience.
So majority of the stress is a result of us resisting the experience as is rather than accepting the experience.
Yeah. And again, if I link another spiritual angle here is Vipassana, right? Yeah. So it just is.
Yeah.
It just is what it is. There's no rag, there's no dvesh, like getting attached to, this warm cup of coffee is so nice, or why is it so not warm or so cold or so hot? Like I either like something or I don't want it to be something. So I'm attached or I'm averse to some situation.
So now I want to understand this because when I did Vipassana, I think I did it in 2014, which was almost 11 years back. I did not have the level of awareness that I have right now, but still I had like a good takeaway from there. But what I understand today is the mind is designed to run towards pleasure and run away from pain. What is the purpose of mind then?
Well, I mean, I guess we should talk both ways, right? I mean, maybe the spiritual teachers will give us a different answer. In the medical world, the human mind is probably the most evolved form of mind there is in the animal kingdom in terms of all species. So, what is the purpose of all this evolution? I don't know. I think we're doing some pretty nasty things to the planet right now with the human mind. So, it can be a very destructive tool if we don't become aware of what we're doing when we're running into and feeding into negative emotions. So, I'm not sure what is the whole purpose of the mind, but at least in the human experience, it's an option, right? You can either choose to the mind is a thinking machine. Its job is to generate thoughts. Now we can either run with those thoughts or say, okay, here's a thought coming. It's a positive thought, it's a negative thought. Do I want to engage? Do I not want to engage? Let it go. So there's me who's watching my mind do this, right? So the mind's job is to generate thoughts.
So now, for example, let's say I'm feeling a specific emotion right now. It could be fear or anxiety. It could be feelings of gratitude. So now I understand how the feeling is, but what happens biologically in my body for me to feel that way?
So yeah, so feel good hormones, right? So normally we talk about serotonin, we talk about oxytocin, we talk about natural endocannabinoids, which, we talk about marijuana and weed. That's the cannabis. There are natural similar chemicals in the brain that give you that sense of well-being, calm, and we can tap into that pharmacy naturally. We don't need to be taking any supplements. Just being around people you love, having good company, physical touch. So you can do it to yourself by being in contact with good environment, good people, good conversation. You can do it by breath work. Activate these calming hormones, the parasympathetic. There is two systems. We talked about the fight, flight, fright system. That's the sympathetic nervous system. It has to help you get up and go. There is the parasympathetic, which is the calming, rest, repair, digest. So I love geeking out. So I wear this Aura ring and it always monitors my heart rate variability.
Okay.
So it tells me if I'm in a constant high stress mode where foot is on the accelerator, it's just not giving me a calm down time. And if I do some focused deep breathing, if I am in good company, so if my best friend comes over or if I'm with my husband and my daughters, my pulse rate, my heart rate, everything moves into a healthier zone.
Okay.
And the rest, repair, digest system is more activated, parasympathetic. The good news is we can use breath work. You can use pranayam, and activate this whenever you want.
Okay, so you don't have to be dependent on something external like weed or marijuana or something else. So basically, what happens when somebody consumes a psychedelic? What happens to their brain?
You're pressing on the receptors artificially.
Okay.
So that desired effect will come. Now, receptors are such that when you do something chronic, it's like, people who have been in the kitchen for many years, they don't feel the pot so hot.
Yes.
A person who's just entering the kitchen for the first time, they'll touch something and they'll drop it.
Yes.
So that desensitization of a receptor is a normal thing, that beyond a point, if you keep on giving a stimulus, the body's like, too many inputs coming, let's reduce the response. Or if it's too loud, you're sitting in a noisy concert, you'll dull down your response to that noise just so you can focus on something. Same way, if you're naturally stimulating a receptor, then the molecule is attaching and then in its natural due course of time, it's removing itself.
Okay.
But when you do artificial introducing of stimulants, in fact, the most widely abused stimulant in the world is caffeine.
Okay.
I love my coffee though. It is artificially going and stimulating the receptors beyond what would be naturally possible by the body. So maybe more hours of it. And then because it's staying attached for longer, we've all seen like, oh, that one cup of coffee is not doing it for me. Let me have two, or I make it stronger.
Okay.
Because I'm not getting that hit.
Okay. What used to give you the hit initially does not give you the hit anymore because it has hit the threshold right now.
Yes. The body's saying bus. Dopamine, same thing. What is dopamine? Why do we get, what is this whole addiction that we talk about? That first hit. And then we're not getting that same first hit. So we keep trying to get that same hit. But because the first one was so strong, the body is trying to, block such a strong response. But we want that. So we keep chasing that dopamine hit.
So any form of addiction, right? I believe it is a way that human beings have kind of used something on the outside to fill a void on the inside. And now with so many avenues opened up, be it Instagram, social media, porn addiction, alcohol, and a lot of it. I mean, people have way too many things to use to numb themselves. So help us understand, how do you treat, I mean, how do you talk to people with addiction?
Yeah. So the most common one that comes in my world, because I'm an endocrinologist, two of the conditions that show up in my practice a lot are diabetes and obesity.
Mm.
Now, you could say there is some element of food addiction there, but again, it's not me who, as the doctor, is going to say that. I ask the person, do you feel addicted? Do you feel like if there is something in front of you, you can't resist?
Okay.
They'll say, yeah, I feel like I have a sweet tooth.
Mm.
What do you mean, sweet tooth? No, salt cravings. Once I start, I can't stop.
Mm.
I'm like, but that food was engineered to be such. So if you stick your hand in boiling water and you get burnt, you don't say, I have a boiling water weakness.
Right.
It's not fashionable. It's not trendy. There's no money to be made from you having a boiling water weakness. So nobody's made a product out of it. But for you to have a chips weakness or a French fries weakness or an ice cream or a chocolate weakness, there's definitely some money trail where we can sell you things now.
Okay.
So some of this, when they say I'm addicted or I'm a foodie, some of it I have to make them realize, hey, you're normal. Even me, I love food.
Mm.
If I eat something very tasty, which has been created with millions of dollars of research, I will feel an addictive sense of let me have more. That's normal.
Mm.
It's not my weakness.
Mm.
It's the way my body's brain chemistry is responding to this formula.
Okay, help me understand how the chemistry is responding. For example, let's say I'm taking a packet of chips and I'm using the same flavors on a bowl of broccoli. I will not finish this, but I will end up finishing 2 packets of this.
Correct.
What is happening in my body?
Yeah. So there's something called sensory specific satiety
Mm.
or a bliss point.
Mm.
Okay. Now, broccoli, the brain, because of millions of years of evolution, it knows what broccoli is.
Okay.
Now, these chips, they used to say that don't eat something that your grandmother can't recognize as food.
Yes.
So these chips, these funny flavored and shapes, she'll be like, or it'll be like, what is this?
Mm.
It's not food.
Mm.
It's not been made at home. It can't be edible, right? So what has been done with this processed food, ultra processed or packaged food, is it is something which the brain doesn't even know how to process it.
Okay.
Okay. It has been created to give maximum stimulus to your, I'm talking about it now and my mouth is watering.
Okay.
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 I'm literally getting a saliva reaction just visualizing a packet of chips right now.
Okay, that's the conditioning that we've gone through.
Yes.
Okay.
Okay.
Mm.
And what I was about to say, but my brain is working at this subconscious brain is working so fast.
Crazy.
I was about to narrate to you imagine how the packet of chips is working on you before you even put it in your mouth.
Okay.
When you walk by a vendor who has those red, blue
Mm.
packets, the coloring is also formulated.
Mm.
The sound of the bag is formulated.
Mm.
How it should open, how the lid should come off, formulated. How it's finger food. It's something very easy to be addicted, distracted. And, an Indian plate of food is not easy to eat with distraction.
True.
You have to actually look
Yes.
and, Japanese food, chopsticks, you have to actually pay attention. There's no way for you to be mindless. Now, this addictive food, mindless eating is part of the process.
Mm.
So the way it comes, even the amount of finger licking which you want, that also has been planned. How much particle transfer you should get.
Oh God. Okay.
Okay. So food science as a degree, they're all being hired into these labs to make these formula. So when you ask why does broccoli covered in the same powder not give you that? Because broccoli in itself, you'll get that natural recognition. This food goes up to a limit. Now, I'll give you the same question in a different way. French fries, universally loved. Who doesn't love fried salty potatoes, right? Now, if you think about the 3 main ingredients in a French fry, it's a potato, oil, salt. French fries, you can pretty much go on and on and on. You don't feel full. You just keep going. Broccoli, you'll be like, bus, enough, right? Now, if I separate the potato and the oil and the salt and I give you unlimited access, here's all the potatoes you want by themselves. Your sensory specific satiety, your brain will say, I recognize this as a potato. I know when to stop. If I
Okay.
give you the whole 5 liters container of oil, you'll be like, I recognize this as oil. I need to stop. I give you the container of salt. Your brain's like, this is salt.
Right.
But when you combine it, you have done something that evolution has never seen before.
So, because there's a lot of fear mongering around diabetes, right? What is the actual cause of diabetes?
So we should talk about 2 types,
Okay.
type 1
Mm.
and type 2.
Mm.
So both of them will come with high glucose.
Mm.
Now the word on the street will be, what is diabetes? Sugar problem.
Mm.
Sugar was high.
Mm.
Okay, that's the way you say that. How did you know you got malaria? I had fever.
Okay.
Okay, but it could be typhoid also,
Right.
right? So fever. So the high glucose, think of that as the fever.
Mm.
Now, what is the cause of the fever?
Mm.
What is the cause of the high glucose?
Mm.
So in type 1 diabetes, the cause is your body has stopped making insulin.
Mm.
Insulin deficiency. In type 2 diabetes, high glucose has come because of insulin resistance. Insulin is there, but it's not working properly.
Okay. Why does this body stop making insulin in the first place?
In type 1 diabetes, sometimes it's viral, it's unknown why, it's genetic, it's after a fever, it's just out of the blue sometimes. It could be after surgery that the pancreas has been damaged or removed, or inflammation of the pancreas. These are like some of the top 5-6 causes where the pancreas is damaged, where it just cannot give you the insulin required amount.
Okay.
These people, as of today, research is going on, but still we don't have a cure for it. These people would be depending on insulin for survival.
External insulin.
Yes,
Okay.
they have to be given insulin to stay alive.
But majority of the population has type 2
Type
diabetes.
2.
Okay.
Yeah, so in that, the body's making insulin, but it's not working effectively. We call this insulin resistance.
Mm.
Now, it's a big problem to not pay attention to this.
Mm.
So till 2013, I wasn't really thinking about this properly. And when this man said, I'm not going to take insulin, I realized that I need to work with him on lifestyle.
Mm.
And that's when I realized he didn't have insulin deficiency.
Mm.
He had insulin resistance.
Mm.
It was wrong for me to offer him insulin.
Correct.
But our treatment training is 1 tablet, 2 tablet, 3 tablet, 4 tablet, 5. Try the GLP-1s now, which has already come on the market, right? The Ozempics, the Mounjaros.
Mm.
Try those at some point before so many tablets. And then, worst case, go for insulin.
Mm.
We are never told to go to the root cause of why is insulin, natural insulin, not working.
Correct.
We're not trained on that.
Mm.
The doctors have been taken away to become prescribers of drugs. The other healthcare workers like dietitians, nutritionists, all of them are trying to do the lifestyle, but they don't get the authority to tell us to stop prescribing all these things, which is causing trouble in their practice. So there's a breakdown in the system. And so this type 2 diabetes then gets just pushed into eventually getting onto insulin, or they'll be given tablets, which cause the body to push more insulin into the system.
So now, in the first place, why does the body become resistant to insulin?
So many causes. One of the big ones is weight gain.
Okay.
Some could be family,
Mm.
is like in the it's you
Mm.
say hereditary. But again, in my family, it's there in my family tree on both sides, mom side, dad side. I developed pre-diabetes
Mm.
in 2013. I could have said, oh, it's in my family. And I could have just said, now I have to become diabetic.
Mm.
But I was like, nothing doing. My DNA family is the same. The
Mm.
hereditary is the same. But I did everything I could to change all my habits. And today I have absolutely no diabetes. It's been more than a decade. So we should not just fall into the trap of it's in my family, so it has to happen.
Okay. Not necessarily.
Not necessary for type 2.
Mm.
Not at all. It's a lifestyle disease.
Right.
Okay. But within causes of insulin resistance, why does insulin stop working? Some is family tendency, some is weight gain related, and there's 5 lifestyle factors,
Mm.
right? So nutrition can cause insulin to stop working. How? By eating lots of carbohydrates.
Mm.
If that's all you're eating, remember we talked about too much dopamine, then finally your body will resist listening to so much dopamine messaging. If I'm eating carbohydrates and sugars all day long, eating all day, 3 hourly, snacking, munching late into the night, my body's constantly pushing insulin into the system. So the body's going to say, I'm not going to listen to so much. It's too much.
Okay.
So the response gets resistant.
Okay.
Nutrition,
Mm.
sleep. You can give healthy people pre-diabetes in 4 days by cutting sleep. In 4 days.
Okay.
If you take them healthy, so this is a very famous study, healthy volunteers, normal, brought them in, cut their sleep to 4 hours. And within a week, they had prediabetes just by cutting sleep. That's how stressful it is. And we in India, working economy, late nights, outsourced BPOs, call centers, commutes, trying to work both sides, manage the house, manage the office. It's sleep is a big problem in India. Noisy environments, it's not quiet when we get back to our place to sleep, honking. So there are a lot of problems. Of course, screens disrupting sleep, blue lights and artificial stimuli. There's no sunset. Sunset should happen by 6:30. You'll feel drowsy by 9:30. But we have artificial lights poking. So if I'm watching my phone till midnight, sunset happened at midnight.
Right.
But I'm trying to get up at 6. But my brain is on 1 o'clock in the morning. Like it's 5 hours of jet lag in my brain every day. I try to get up and I can't get up. Why? Because you didn't have sunset on time. So sleep can cause insulin resistance. Chronic stress, cortisol. See, cortisol was supposed to help you run away from that tiger. Burst some glucose into the system, power the muscles so they can run with that energy burst. Chronic. Now glucose is staying high. What was supposed to be a life-saving stress, chronic stress, now becomes prediabetes, diabetes, just from stress. Exercise. See, in India, we love walks. We love yoga. We're still gradually, and I saw you brought on a very fit person recently on your podcast.
Yes.
Very important that we must publicize muscle building. People still in India need to know more about this. It's a very good thing that it's picking up, but people need to be building muscle. Indians lose muscle very badly. Again, the protein deficiency comes into the picture. If you look at the average Indian body type, they're very slender on the arms and legs. They might have the belly, which is all insulin resistance. So when people say, so much of my weight gain is just on the belly, that's automatically you need to think insulin resistance.
Okay.
So they may not have diabetes yet, but that's one way to get there.
But when you build muscles, how does it help you be healthy?
Yeah. So I talk about this in my book is we have 3 musketeers in the body which manage glucose: liver, muscle, pancreas. The liver provides glucose. Okay. So when you wake up in the morning, you didn't eat all night. How did you not die of a coma overnight? Is how did your brain stay active? The liver was providing overnight glucose while you were sleeping.
Okay.
So when people say my diabetes, my morning glucose is always high. That's your liver crying and complaining that you put so much into me during the day. I'm not done cleaning. I'm still throwing out all this glucose because insulin resistance, there's too much glucose. The liver is trying to dump it out. So the liver is the glucose provider. Pancreas makes insulin. Insulin is the glucose regulator. Dial it up, dial it down. If you're fasting, you don't need so much insulin. I'll dial the insulin down. If you have a big cake or a big ice cream or big biryani or something, lots of insulin required, I'll dial the insulin up. So that's regulator. Muscle is the glucose taker. Its job is to take glucose during the workout and at rest. So the more muscle you have, the more your glucose stays normal.
Okay. All right. So of the 5 things, nutrition, sleep,
Stress management, exercise,
and the last one?
fasting.
Fasting. Okay.
So the way I describe this is the 4 wheels of the lifestyle car. 4 wheels: nutrition, sleep, stress management, exercise. In order. So nutrition is first, sleep second, stress management third, exercise fourth. If you have a car, only when your 4 wheels are in good condition, you'll go driving on the highway for a long drive. If you try to go for a long drive with a puncture in any of these, you'll land in trouble. So now fasting, we've heard on the internet, intermittent fasting, IF, right? People are using the word and trying it on their own and saying, fasting didn't suit me. Fasting didn't work for me. When I come into the picture as a mechanic, hormone mechanic, I'm like, but there are punctures in your wheels.
Okay.
Your nutrition, sleep, stress management, exercise, there is an issue here. Fasting is not going to work for you. Your car will get stuck. I had acidity. I had headaches. I felt too hungry. I felt weak. I had low energy. All because fasting has not been introduced properly. When it's added properly, that's how you train the body to burn the stored fat, because insulin levels will go down and you'll be able to access the stored fat. As long as insulin levels are high, the body's being told, store the fat. Don't use it.
Okay.
So low insulin is also a message.
Mm.
It's saying burn fat. Food is not coming from the outside. Insulin is going low. There's nothing available. Oh, insulin should go low. Stored energy should be burnt.
Okay. That's what happens during fasting.
Fasting. So what does not work in dieting? Oh, I'm on a low calorie diet. My healthcare professional has put me on a low fat, low calorie diet. I'm eating 6 boiled meals a day or some steamed light food, right? Horrible idea. It doesn't work. Why? Because every time you eat, your body's releasing insulin. Fuel has come, store it. Especially if it's low fat and light, it's more likely to be carbs. Carbohydrate creates the maximum insulin response. So you've got high insulin coming, not enough calories are coming. It's some boiled light thing you're eating.
Mm.
So insulin is there saying store it. Okay, store it.
It'll store everything.
Store everything.
Okay.
But my body needed, let's say, 1600 calories. I was put on a 1200 calorie weight loss diet. But insulin also came to say, don't burn those.
Mm.
So no, those low calories are coming in and being stored. Can't touch. So now I'm hungry because I'm not able to use what I have.
Mhm.
I'm miserable. I'm underfed. And what is my body going to do? Is my body going to keep spending at the rate of 1600 when it's only getting 1200 and just die off?
No.
No. It's going to say, let's reduce our metabolic rate. We will not spend 1600 calories a day when we're getting only 1200.
Okay.
So people's metabolism slows down on long-term, low-calorie, low-fat diets because they're chronically undernourished and insulin is blocking you from using what was there.
Okay.
So people will argue. In fact, I've had discussions with some of these Instagram people about this. It's all about calories,
Calorie deficit. Yeah.
calorie deficit. So even fasting is a calorie deficit, no?
Mm.
0 calories, quite a deficit. But insulin has moved aside.
Right.
So you will use the fat. The body does not count calories. The body listens for hormone signals.
Very interesting. So now, what is the best way to lose weight then if I'm not on a calorie deficit?
See, the problem is if someone comes to a clinic where they're going to be given a diet, they'll first go out and have their favorite food
And then,
and then come because now that final goodbye has to happen, right? Someone's going to ban it.
yeah.
Psychologically, I'm rebelling already.
Yes.
Okay.
Yes.
So I don't do it for that reason.
Okay.
Besides the hormonal approach, that psychological thing matters. So we first say nutrition, eat enough protein.
Mm.
I don't want this psychological backwards reaction of they're going to take away something.
Mm.
Nobody likes that. FOMO is a problem.
Right.
So I don't want FOMO. So let's give you more. No? Eat more.
Mm.
Eat more protein at each of the 3 meals.
Mm.
Oh, I'm so full. What would you like? Would you like to be hungry all day or full all day?
Full.
Full.
Mm.
Good. Have enough protein and feel full.
Mm.
Automatically your carbohydrates would reduce.
Okay.
I don't have to now take them from you and make you feel like she took it.
Mm.
I'm giving you more protein advice. You will naturally be. So, example, if someone had 2 chapatis, 1 cup of dal or fish or something, or curd, I'll say make the 2 chapati into 1
Mm.
or 2 cups of rice, make it 1 and double your protein source and see how you feel. Don't do it because I said so. Give me a feedback. So I always want to get this communication going that tell us how you felt. Invariably, 100% of the times when people are getting sufficient protein, they are full. They don't mind that the carbohydrate has become less.
Because they feel full.
Satiated. Okay. Protein is very satiating. Cravings go down. So people who say I have a sweet craving, 4 o'clock, I need something, 5 o'clock, 6 o'clock when I come home from office, that's the worst time. 10 o'clock, 11 o'clock at night, I'm looking in the kitchen for something. All this goes away when they start with enough protein divided across the 3 meals.
So craving is an indicator that the body has not received enough protein.
It wants something.
Okay.
It could be water, it could be salt, it could be protein.
Okay.
So we fix all 3. Dehydration can feel like a craving. Salt deficiency can feel like a craving. India is going through peak summer right now. We lose a lot of sweat, a lot of salt. Being salt depleted can feel like a craving. And people don't get marketed salt. They get marketed sweet. So they go and they eat sweet.
Right.
Okay. But they stay stuck in this trap. Dehydration. Okay. Sleep deprivation can come as a craving. Protein deficiency will cause cravings. So when you fix this, their relationship with food starts to get better.
Right.
Energy gets better.
Mm.
Whatever development repair projects were pending on hold, the hair fall, the skin is bad, the gut is bad, the sleep is bad, the mood is bad, all the repair molecules are now available. Finally, you have the raw materials to do the repair work projects, beautification projects. People are always complaining about hair and skin. They go and stick keratin in the parlor, right? What is keratin? It's protein. Spas will put keratin treatments on your hair. It's a protein. So if you would eat the protein, you would get your beautification projects and your fundamental repair projects, which were lacking. So protein. All this connects to weight loss. You asked about weight loss. All this is the foundation for that. And we specifically tell our patients, don't get on the weighing scale for 6 weeks.
Okay.
Everybody gets on twice a day. They go to the washroom, flush, and then they go stand. I'm like, do you know what you weighed? You just weighed the weight of what you flushed. It's got nothing to do with the weight of your body.
True, actually true.
Okay.
It feels like a personal attack.
Yeah. But we've all done this.
Yes.
I mean, the curiosity, right? Oh, let me go and now see what I weigh, right? I mean, we know, we've been there, so we know what people are doing behind closed doors, right?
Yes.
So the thing is, wait for 6 weeks before getting back on the weighing scale whenever you're doing any of these lifestyle changes, because there is water fluctuation. There is that bloating or that fluid retention, which will happen initially when you... So I was telling you how high carb makes high insulin. Insulin not only holds fat and holds fuel, it also causes water retention.
Okay.
Salt retention. So the person who is insulin resistant will also be the person who says, I feel a lot of bloating. I feel puffy. My rings are tight. When I wake up, I feel like it's all puffy. My legs are swollen. There's just a lot of water in me. And so usually when they go on these diets or when we do lifestyle change with us, as the insulin levels come down, that extra water weight goes.
It's so interesting. I mean, every person I've spoken to so far, when we speak about weight loss, all they speak about is calorie deficit. But this is so refreshing to understand that I don't have to push off anything. I just need to include more of what my body needs.
Yes. And all our patients end up losing body fat without counting calories. We don't. So I've made my own app with my husband.
Okay.
And there's no calorie counting button in that app.
Okay.
It's only count carbs and proteins.
Okay.
We don't even have them count the fats.
Unlimited fat.
Healthy fat, you'll feel full because fat is satiating. If I give you a stick of butter, how much will you eat?
True.
You're going to be full.
True.
I give you that 5 liters of oil. How much will you?
And what is that one belief you had as a doctor when you started out, but now you don't have it at all?
I used to think that it's my job to fix people or my job to create healing in people. It's totally false. We cannot heal people. We cannot change people or fix people. If anything now, my prayer is, can I be a guide? If someone is looking for a path, they want clarity, they want knowledge, they want support. Can I be a GPS Google map that's navigating? They're driving their life. They are masters of their life. I'm nobody to assume that my degree on the wall means that they'll do exactly as I say when they leave this room and go into their life.
They also think the belief has shifted because now you don't identify your sense of self-worth based on how your patients are, but you truly know who you are. You're giving them that value, and it's up to them to take it or not take it.
I think so. Yeah, I may not have connected the dots, but definitely knowing and feeling right in your own heart that I know I'm going to do best for this person. And it's a 50-50 or it's a 100%, 100%. I'll put in my 100%. They'll put in their 100%. But there is a space in between us, which is the relationship, the doctor-patient relationship. I can't go onto their side of the universe and be for them. I can be around, and a lot of times this comes up in our own relatives and our family members is you have all these degrees and you want to change them. But unless and until your loved ones have internally decided that this is what they want to do, it's very obvious in your closest relationships that you have to give them that space for them to take ownership of their journey forward.
Yeah. That's why they say people don't change for anybody. They only change for themselves.
Exactly. And the sooner a doctor realizes that, especially in the way I'm looking at healthcare behavior change, the sooner we realize that, hey, our job is to be as high quality a support system and knowledge base for them. So, like this calorie thing, our job is to remove scientific myths,
Mm.
bust the information, empower them with the right scientific knowledge in this noisy world where so many influencers with so many opinions, nobody knows what to listen. So, we should give them that trusted space to get information,
Mm.
help them make their decisions.
Mm.
So, a big part of my work is coaching,
Mm.
motivational interviewing, for example,
Mm.
right? So, this was a big revelation for me, is the whole change in the dynamic. It's a meeting of two equals.
Mm.
Motivational interviewing means we are equal,
Mm.
and you are the expert of your life.
Mm.
I might be an expert with my degree in hormones or diabetes, but you are the expert in you.
Mm.
So, for this to work in your life, which is all about behavior change, you are the expert in your behaviors.
Mm.
So, let's say somebody says, I have a sweet tooth, and they're seeing me for diabetes.
Mm.
So, the sarcastic response in my head could be, what do you want me to do about that? Right?
Yes.
Like, are you crazy?
Yeah.
I mean, you have this, and so be judgmental.
Yes.
Okay. So that's definitely not going to help.
Yeah.
So, not that response. Okay. So, how to be in a motivational interviewing space is, can you show the person that they're stuck?
Mm.
They've trusted you with this information,
Mm.
right? They're struggling. So, what does it mean to be stuck? Stuck means I have one need on this side, I have one need on this side, and both the needs are pulling, and I'm caught in the middle. What are the two needs? On one hand, I can see that you enjoy sugar. Perhaps it gives you some pleasure. Perhaps it gives you reward at the end of the day. Perhaps it's a distraction from something else, and you need it. And on the other hand, you're talking about this right now because you're also thinking about how it affects your diabetes, and you want your diabetes to be better.
Mm.
And you have both of these needs, valid needs on both sides,
Mm.
a need for pleasure, a need for health. And then when you say it like this to that person, for the first time, they don't feel judged or shamed.
Yes.
They feel heard and
Heard.
seen.
Yes.
That changes the whole game.
Mm.
So, discovering this tool of motivational interviewing has been, again, career changing for me, life changing as a parent, life changing as a spouse. Now, I cringe when I hear people not using it in life because this comes in daily conversations.
Right. Why do you think a lot of doctors are not doing this?
Not trained.
Okay.
That's one big reason.
Okay.
It's a skill that most people don't have.
Mm.
Luckily, the psychiatry space in India is definitely picking it up. It is a training that they get.
Mm.
But in the diabetes or in the traditional, emergency of like allopathic fracture or pneumonia or, ICU, it's very difficult to talk about behavior there because they're dealing with a crisis.
Okay.
Okay. So, and maybe it hasn't yet been brought in as a training concept.
And also, now that we understand chronic stress, unhealed trauma, all of this has a huge impact on how we feel on the inside. Do you think that there should be equal number of therapists as many number of as there are surgeons?
Yes. So I think we have to help people with negative emotion. And allopathy is about doing surgeries and giving antibiotics and giving a quick fix or a curative procedure, right? That's what hospitals medicine is required. We need that. We need surgeries for fractures and broken bones and ruptured organs. We need antibiotics for life-threatening bacterial infections. But there's this whole other aspect of healthcare, which is chronic, long-term conditions driven by negative emotions, driven by habits or pollutants or other things that are keeping us chronically sick. And there's a very different level of work that needs to be done there. On the contrary, more work, more people on the field, more feet on the ground.
Right. And also, do you believe, because of your personal journey that you went through in 2013 and you had to go through a spiritual journey yourself, your understanding of this is way better? Let's take it two paths, right? One path, you never went on this journey, and the second path is the path that you're on. Do you think both the versions would have had the same level of awareness that you have right now? No.
No. Without my own spiritual awakening, I don't think I could be the person I am today, because I had to break down so many beliefs in my head, so many attitudes, so much ego, arrogance, judgment. there was no space for a deeper wisdom to come, and I think the spiritual journey is you discover yourself, and through discovering yourself, you instantly realize it's same. There's just a degree on the wall, maybe, but we're two human beings in the room. If it's a doctor patient, we're just two human beings. But how will I have recognized the other if I've not recognized myself? So I don't think it would have been possible. I don't see how I could have.
Do you think the medical fraternity is now slightly opening up to conversations like these? Or is it still rigid?
In India, we're still able to ask these things to each other.
Okay.
I get shot down sometimes. It's like, you're asking for too much, or that's not possible, or my OPD is too busy. So people will agree. See, there's this word called cognitive dissonance, which is, I am uncomfortable when you say this to me because it's true, but it makes me so uncomfortable that it's easier for me to shut you down than process and go deeper.
Okay. The shutting you down is a result of me not being able to handle my discomfort.
It's uncomfortable.
Okay.
So easier to just push you away with your ideas is, oh, she's unconventional, or, oh, that's okay in your practice. I can't do that because I have such a busy practice. And they're not wrong. They're not wrong. They're right. So it's okay. I don't think this is everybody's journey, right? This is I don't want to judge anybody. I think we need those doctors doing what they are doing, because if I'm sick, I need them.
Yes.
Right? For the thing they are good at.
Yes.
So this is not a judgment, but everybody might be having their own purpose on earth, why they are here. For me, I don't see how I would have been any other version except this. And if anybody asks me to now lift myself and go be in some typical role where I have to do what I used to do 10 years ago, my hands would just be tied. I would just be like fully uncomfortable. I would be uncomfortable.
So now, do you believe the Indian healthcare system leans more towards prescribing medication rather than promoting healing?
Unfortunately, yes. I think traditionally we think of hospitals, or we think of busy clinics or OPDs. The sheer volume of numbers that we see. Just yesterday, one of my patients asked me that her hemoglobin A1C, which is the diabetes average number of 3 months glucose, was just above normal. So she was just into the diabetes range. And her liver doctor said, oh, it's okay. And she came back to me saying, why was he okay with that? I know I want to be below the pre-diabetes range. I want to be in the normal range.
What is the normal range?
Below 5.7.
Okay. And 5.7
is pre-diabetes starts.
Okay.
And 5.7 to 6.5 is considered pre-diabetes. 6.5 and above is diabetes.
Okay.
Hers was 6.7. So he said, oh, not too bad. Because she had come from a 9 or a 10 or something, and working with us for 3 months, she had brought it down. He said, you're doing something fantastic. Please keep doing what you're doing. She had a fatty liver, reversed it. So she was like, just because the fatty liver is gone and now the 6.7, why is he so comfortable? I want more better results for myself. So this comes to the point, she asked me that, why did he say that? I said, Baba, you have to understand, you are the healthiest person in his waiting room right now. He has people waiting on the edge of liver failure, needing a transplant because their liver is so damaged from all these lifestyle, not even alcohol anymore. It's just these carbohydrates and sugars that are causing most causes of liver failure now. He's putting out fires. He's in firefighting mode. These are good doctors. They want to help their patients, but they're up to here in severe, advanced disease. And doctors, unfortunately, allopathy as a field evolved from the reactive or the curative or the acute phase, which first used to be surgeries and antibiotics. That's how modern doctors came initially. Now diseases have changed. Now we have chronic diseases, non-communicable diseases, diabetes, obesity. There's no one-time fix. There's no quick pill. There's no quick one-time intervention by a surgeon. So there's no training on the preventive or on the healing side for any of this. Plus, if I read back into my training days, all my training was emphasized on pharmaceutical, drug-based. There was no training time given to nutrition or the lifestyle. It wasn't part of my training.
Probably because back then there was not enough research done to understand the other,
No, the data was always there.
It was there?
Yeah. I'm 15 years out, but the knowledge that diabetes can be turned around through lifestyle changes has been there since before that. It's more known in the media now. In the lay audience is more aware, but the scientific audience has known about this.
Okay.
Yeah. So there are probably vested interests that keep the status quo, because we talked about the food industry selling us and marketing us things. Pharmaceutical industry is definitely benefiting from the status quo. Why would they want doctors investing in reducing prescriptions when stock markets are driven by pharma companies doing well? There's an obligation to shareholders. Pharma companies are not obligated to delivering health. They're obligated to deliver stock price improvements. So the medications, if they would cure you, then you would stop taking the medicine, right? So we talk about the obesity drug. We're being told you have to be on it for life. So the marketing to the doctors also, when they go for these conferences, see, as an endocrinologist, we get called in. I'm no longer popular in that lecture circuit because I always talk about reducing medicine. But the degree of endocrinology is the highest degree in hormones and medications of diabetes and obesity. So we lecture to the MD medicine, to the GP audience. Oh, this is a good drug, right? So we're influencing thousands of prescribers. Those thousands of prescribers will prescribe it to their thousands and thousands of patients. So the pharma industry keeps that messaging that you need to be on this medicine for life. Obesity is a chronic disease. So we suppose go into these speaking events saying that it's a chronic disease, you need to be on the medicine for life.
It's because doctors like you are influenced by the pharma industries.
Yeah.
Okay.
We're paid. We're given a car, we're given an iPad, we're given a gift, we're given a pen, we're given some treats. And we are, this is the psychological. So in the US, it's now, you're not supposed to give any kind of gifts and incentives to doctors because that's kind of like a bribe. In India, it's getting more caught now. So you're not supposed to accept gifts from the pharma industry. But there are still workarounds, and the interactions are always there that let's have an event, we'll give you a professional fee. And so these things are, it plays on a human being's mind if you're paid for something. And you may like to tell yourself that, no, I'll only give the lecture, but I won't let it influence my practicing habits and my prescribing habits. But science has shown that prescribing habits do change.
Okay.
So you may lecture on something and very likely you're going to be affected and you're going to prescribe. So the messaging to the medical audience is that these are chronic diseases. I had a doctor as a patient. Diabetes, kidney is on the edge of failing now from diabetes. She's a doctor herself. She was told you need to be on insulin, but her body was making insulin. She was told you have to be on insulin. Insulin is better than pills. She accepted the prescription. And she asked me, but now I'm supposed to be on lifelong insulin. Why are you taking away? I said, but it's the wrong treatment for you. Where have you even gotten better? So even as a doctor, she's not aware that healing was possible or that reversing this was possible. She thought it's just inevitable that my kidney is going to go. It's a chronic and progressive disease. So the it's multiple reasons why the healing element is not there in allopathy. The training is not there. The reverse marketing is very strong that it's a prescription based approach only. So and the volume of patients. These are like three huge reasons why we are where we are.
It's crazy.
It's a big problem.
I mean, for general people like us who wouldn't understand anything, who would just blindly trust a doctor with the medicines that they give. I mean, sometimes we're not even sure if the doctor actually knows the repercussions of the medicines.
Of the medicines or a wrong advice on diet. Now, although we're not trained in diet, we still give diet advice. So sometimes doctors give wrong diet advice because they've not studied it. They've not read the recent stuff. And my MBBS I finished MBBS 24 years ago. Imagine I didn't read after that. What if I'm still telling you something from my MBBS days, which is how outdated now. Okay. And if I talk about physiology, that textbook I read 30 years ago because MBBS is a 5-year program. 30 years ago, I studied something. And what if I've not revised my knowledge? I've forgotten. I've, heard something, influenced something. So doctors need to stay on their toes. So in my book, I actually have a section, how to talk to your doctor. Questions to ask your doctor, topic-wise. In diabetes. Under nutrition, what should you ask your doctor? Under this. Patients should be empowered because otherwise, like you said, maybe the doctor hasn't read up on this.
Yeah.
Hopefully, your doctor is curious and respectful of your question and will go home and read and come back with a better answer tomorrow. And if they don't, and if they just expect that you should blindly give your health in their hands, but you might be on a wrong track, then maybe you reconsider whether your health needs to be with them, because you deserve your health.
And your entire approach of healthy eating was so refreshing for me because you're the first person who told me not to count calories. But when you look at all these influencers, people who don't have a background of prescribing or helping people with all of this, and they come up with something that says, do this, do that, lose weight in 7 days, do the keto diet, paleo diet. How does it make you feel?
So, look, I have to thank the fact that the conversation is getting started. Maybe 10 years ago, so I started, actually, this is a funny story. 2014, when I started talking about diabetes reversal, I got scolded. I got pulled up saying, don't say this. And literally, the sentence told to me was, what if a patient hears you talk about diabetes reversal and goes and eats so many mangoes and then their glucose becomes 300? That'll be a case for us. So don't talk like this. 2014, I had given a lecture and the circular was distributed that this is the topic, come for this educational event. And I was scolded for it 10 years ago, 11 years ago.
Okay.
So that's how lonely the space was back then, that I was being pulled down for saying it and told not to say. So I'm thankful that in the last 10 years, people are talking about diabetes reversal now. Now you see so many startups in the space. Are they all doing it the way I think? But they should not, they're not obliged to. Let them do it their way. At least they're raising awareness. At least there are people in the industry talking about it and telling patients that reversal is possible. Right? Now, the customer or the patient has a chance to be more informed. Oh, there is an alternative narrative that's possible. Should I judge? No, I don't want to judge. Now, they might be believing in what they're saying, so they're saying. I'm sure they're not trying to harm the patient. Nobody's evil that way, right? So, why should I contaminate my real estate with getting into the judge space? But if a question comes, what is right, what is not right, we have to answer it according to what we've done our reading. So, it's okay. Let the conversation continue.
Have you ever seen a case where someone's spiritual growth triggered physical healing without a single prescription?
My own case, for sure. I am a Hashimoto's hypothyroidism case. So, the most common cause of hypothyroidism is autoimmune, where your own immune system is attacking your own thyroid gland. And so, there's an antibody for that, which mine is positive. So, if you do the blood test, you'll see that my immune system is trying to or is capable of attacking my thyroid gland. So, I was on thyroid medication. And after, this sounds weird to say it on internet, but yeah, the only thing I did was learn stress management through Reiki and meditation practice. And now it's more than a decade. I've not needed a thyroid pill. So, is the antibody gone? No. But do I need medicine anymore? No. My blood tests are fine without the medicine. But we are told and trained, once you take this thyroid pill, you're on it for life.
It's not true.
I'm alive. Nothing happened by stopping a pill. So yes, people's learning to manage stress. I've seen people's allergies go away, food intolerances, people who would break out in hives, gone once they did hypnotherapy and they realized there was some emotional block somewhere that was coming out into the skin. Migraines getting better. So what, some doctors, we were trained to call it psychosomatic.
Yes.
Now that word is a bit difficult. I don't want to use that word, but maybe a tongue twister word: psycho, neuro, immuno, endocrinology.
Psycho, neuro, immuno, endocrinology. Okay.
You're smart, so you're keeping up. Psychology,
Okay.
thoughts,
Okay.
neurology, how they affect the brain. So
Okay.
your thoughts are going to fire through your brain neurons.
Okay.
Immune system,
Okay.
immunology, endocrinology.
Okay.
So people having allergic reactions, people having hormone responses to negative thoughts, it's all connected.
Yeah.
It's all connected. Thoughts, feelings, emotions, hormones, gut responses. We say, na, trust your gut.
Yes.
I feel it in my gut. Gut, brain. So how is that happening? The brain is up here. My gut is over here. How are they connected? My brain is not connected to my intestine, but it is through nerve connections, through hormone connections. Everything is talking. How come we feel anxious in the stomach
Yes.
when we go for something? My stomach is just feeling So there is a communication going on.
Yeah.
So it is connected. And yes, being aware, mind affects body, body affects mind. So many instances. And that's why we keep a spiritual therapist in our practice for those who are open to it. They don't have to do a session, but if they want, if they're with us for, let's say, 3 months, if it comes up in conversation that, this event, I'm stressed, I'm negative, it's bothering me, or I can't understand why I keep doing the same habit which is not helping me. Do you want a session? And then they'll realize something. Could be some childhood issue, could be some other life experience, negative experience, and they weren't aware consciously now as adult what was the issue.
It's so interesting. I mean, I believe in this 100%, and to be hearing this from a doctor is actually so reassuring for me also.
That's what. So forget that I have a degree, right? If I was just a human being,
Yeah.
then we were okay that
Yeah.
she's saying something that.
Oh,
is-
yeah. That's true. And why do you think it's easier for people to follow strict diets than to sit with the discomfort or face what's underneath?
Oh, yeah, that's a good question. And I have to be very blunt about that with
Yes.
people, is because patients will be like, sometimes they'll call, can you give me a sample diet chart? What's the sample diet chart that she's going to give? We don't give any diet charts. We're not going to tell you what to eat. Now, why are they uncomfortable with that? And I did an Instagram post on this. Obviously, it's not doing well because I don't know how to promote things on social media. But I said there that the reason people want diet charts is they want to be told what to do. It keeps me out of decision making. I'm off the hook. It's a cognitive load which you have taken away. I don't want to think about what I should eat. You tell me what I should eat. But for me, that's exactly the opposite of what I'm trying to do with you. I'm trying to awaken your wisdom, awaken your self care, give you the knowledge which is clearly lacking because you're not getting the results which you want. I would be fooling myself if I give you a diet chart and say, Gayatri, live like this now, okay? Eat only from this paper. When tomorrow, when there's a rainstorm and there's a wedding and there's this problem in your office, doesn't matter. You have to eat only from this paper. So then again, you'll be off the hook. And then what will be the logic? I fell off the wagon. Where's the wagon? I fell off track. Where do you see a track anywhere? Right? These are all words. These are all just games. So the mind is escaping. Yo, on the diet, off the diet.
Yes.
So there's a mindfulness which I'm trying to help you bring, whereas being on a diet makes you mindless. So I learned this in a course in 2014 by a doctor who had struggled with dieting her whole life, trying to lose weight. And she was like, I'm a doctor. Why am I not able to figure out my own body? Like, what's happening? And she realized that years of dieting, the yo-yo concept is you're either dieting or you're overeating.
Yes.
There's nothing in between.
Yes.
Okay. So the yo-yo we say, right? So she's like, a yo-yo can either be at the top spot or at the bottom. There's no halfway point where a yo-yo can rest. Yo-yo up is dieting, strict, not listening to myself, ignoring my needs, listening to some piece of paper. Overeating is fully listening to what I want, not thinking about health, right? Two extremes. She said, what if instead of a yo-yo model, we switch it to a pendulum model? Where instead of I'll only eat for pleasure or I'll only eat for health, instead of being so extreme, can I come in the middle where I know how to balance eating for pleasure and eating for health? Then the amount of changes required are not drastic. And it is possible to live somewhere here where I'm in a balance. I'm not restricted, I'm not polar and this on diet, off diet. But that means now it's me in charge. Right? So she's like, she made a list and I found it helpful ever since. And this was never taught to me in my medical training, but it was a vocabulary I needed. Was the dieting language: cheating, indulgence, a treat meal, what was the thing she said is in control. I need to be in control of what I eat. I can't control myself. She said, what if you say I'm in charge?
Yeah.
Right? So how do people respond to this? Again, in India, sometimes the culture is such, right? One is they get shocked that, oh, the doctor is giving me decision making rather than doctor deciding what should happen to me. But also this is that, oh my God, you're making me accountable. That if I do it, it's me. If I don't do it, it's me.
Yeah. I think a lot of us just don't want that accountability, right?
It's uncomfortable.
Yeah, it is uncomfortable because it does not go the way I want it to go. It's still me. So I might as well put that blame on somebody else.
Exactly.
And it comes because of habit also. We've been habituated to blaming anything and everything on the outside rather than sitting down and telling ourselves, dude, I am 100% responsible for every single thing that's happened to me in my life.
Exactly. So patients will sometimes tell me, "Hey doc, I'll see you after New Year's. I'll or something. Like I have some patients in the US. They'll say, I'm going to India, and I physically and the doctor is in India, right? I'm going to India, so I'll talk to you once I'm back in US. Okay, why? I won't be able to manage while I'm there. So I'm like, but you're bringing diabetes along with you, right?
Yeah.
Diabetes is coming with you. So there, it's like this mind just doesn't feel like. So we actually have to show them that looks like you feel that you can either travel or you can manage health. You feel you can't manage both.
Both. Okay.
So that habit, we're breaking that habit because all the previous holidays, they would go. And so some people will say, I gain weight on every holiday.
Mm.
Now that I'm back, New Year's resolution or etc. etc. Now I'll buck up. I'm on track now. So the reflection there is, it's a reflective listening style. So you feel like you can either manage your vacations or you can manage your health. You can't manage both. That's how you feel right now. And they've never heard that
Yes.
played
Yes.
back, right? So we are all reaffirming this black and white thinking, all or none thinking. We're not allowing people to come into that middle ground where it's messy.
And if you had the opportunity to redesign how India educates children about sugar and health, where would you start?
In the home,
Mm-hmm.
sometimes it comes on the woman of the house, and I don't think that's right. It needs to be a shared responsibility amongst all the adults. And there's a beautiful book on this by Ellen Satter, and she says that as the child grows, there is division of responsibility. Beautiful. She says when the child is very small, the parent decides what to eat. The parent decides when the family eats. The parent decides where the family sits to eat. The parent makes the eating environment pleasant. This is the job of the parent. How much will be eaten is in the hands of the newborn, is in the hands of the toddler, because baby is not hungry. Baby might not be hungry. So the problem in India is, oh, baby didn't eat much at lunch. So when the child gets down from the lunch table, 2 hours later, the parent is running behind the bacha with some snack or some tiffin and chasing them around, make them watch some digital screen and try and poke the food in. You're creating a mindless eater by doing that. You're not setting a body awareness of I'm hungry or not hungry. So as the child gets older, the child will always be in charge of how much they eat because they know about hunger. So one of the biggest things I always tell my kids and parents who ask about kids, only your child will know how much they can take at a time. So we have to trust and we have to communicate. The problem comes when parents will give this voice, you're not eating enough. Until you eat 2 servings of roti or rice, I'm not letting you get up. Until you eat this much of broccoli, I'm not giving you dessert. I'm training the kid to not listen to hunger, as though parent knows more about portion size than child.
And what are the 3 simple daily habits that can help in reversing diabetes?
So type 2 diabetes, so that's the reversible kind. Definitely we should tell your audience that if they want to know if their diabetes can be reversed or not, because they have to check in with their doctor when they're trying anything, is there's a blood test called a C-peptide blood test. That will tell them my pancreas is making insulin in the right amount or not. Based on that, you know about reversibility. So assuming it's a reversible kind of type 2 diabetes, first most powerful thing is reducing your carbohydrates. This is in the fine print in the American Diabetes Association guidelines. It's just not promoted in the prescription algorithm because then the pharma companies will suffer. But it's there in print. So reducing your carbohydrates. Now again, my psychological way of handling this in India particularly is, before I ask you to reduce your carbs, I'm going to make sure you get protein. Protein at breakfast, protein at lunch, protein at dinner. At least 1.2 grams per kilogram body weight, okay, for counting your expected body weight. That's one of the most powerful things. Fixing the sleep, right? So I think screen time, if we are more and more mindful of it, cut it off like 2 hours before you want to be sleepy, because again, you're telling your brain it's daytime. So it has no preparation for drowsiness. You're not yawning. And strength training.
What advice would you give to someone starting their journey from medication dependence to mindfulness and holistic health?
I like to help people connect to their big why. See, this is only going to, it's a long game. It's not a 2 weeks commitment. It's the entire journey of your life that we're talking about. People struggle sometimes to sustain for the long term. So if it is a push from the outside that your family wants you to change or your doctor wants you to change, it's not going to have much runway. It's
Correct.
going to finish off. So how do we help sustain this for the long term? Can only come when we are in touch with our big why. And the big why, if we can frame it with a what am I working towards? The problem in disease care, in diabetes, for example, is sometimes we're running away from some bad thing. I don't want complications. I saw somebody suffer. I don't want that. So it's fear. But we know that cancer pictures on cigarette boxes doesn't stop smoking from happening. Fear is not working as a long-term strategy.
Yes.
Why do smokers quit smoking long-term? Is because self-love kicks in. I am worth it. My lungs are worth it. I am done putting this poison. Self-care becomes stronger. Self-love becomes stronger. I'm going towards self-care. I'm not running away from lung cancer anymore because that didn't work long-term. So find what is your why that is connected to something you care about, that I want to go towards that. So we ask our patients, what will your life look like when you're done with diabetes? What are the things you would do 20 years from now if diabetes does not run the show? I want to travel. I want to be with my grandkids. I want to grow my business. I want to expand. I want to be there for my family. I have somebody I need to care for. They are not well. I need to be strong for them. Everybody has beautiful reasons why they want to thrive. And it would be a waste if we didn't have them tap into that and we reduced it down to something that, oh, your blood test is not okay. I'm supposed to give you medicine, so you change for my sake. That's such a low value proposition. There's such a beautiful thing sitting inside them, untapped.
Yeah. So now I'm going to ask you a bunch of questions which are majorly solution based questions, right? What's one simple food swap that can drastically improve blood sugar balance?
So recently I had a patient who had pav bhaji and her blood sugar spiked really badly. So a recipe I came up with, or one of my cooks came up with, I shouldn't take credit. She put, instead of potatoes in the bhaji, she put paneer.
Okay.
So the pav bhaji was, we didn't have the pav. It was so tasty because it was made with lots of butter. So it was capsicum, tomatoes, onions, paneer, and pav bhaji masala and garlic and squeeze of lemon. So we skipped and we put cauliflower also. So we skipped the potato and we skipped the peas. And we put paneer. So it upped the protein. It had the same buttery pav bhaji masala taste. Again, my mouth is watering. Okay. And it did not give that big glucose spike. Yeah, because you've knocked off a lot of the carbohydrates. Now, in India, we have to be conscious of not making it so spicy that I need to dilute it with carbs. See, if the gravy is too pungent with heat, that's when the plate full of rice and the plate full of breads and all rotis and all comes, is because I need to take one small piece of the spicy gravy with this much of bland carbohydrates.
Right.
So you got to reduce the heat level of this dish where the other flavors can come, and you don't need that carrying carbohydrate spoon.
Right.
So that's one thing, is like a quick change there. The other thing, what do? We make parathas that are almond flour, and I stick vegetables in there and cook it in good butter. Sometimes I'll add like a protein supplement into the paratha and sesame seeds. So there's no flour. There's no wheat or millet or anything. So it's not giving that same glucose spike, and it's giving you some vegetables and things like that. And again, I would never say eat that because Roshani said so. I would say eat it and have monitored your glucose level before and 2 hours after. because a lot of people will come with these, quick fix diets, is this is the diet for diabetes, and you're blindly eating it, but you're not checking your own glucose response. And so many people are then shocked to find, I was told papaya is fine, I was told jawar is fine, but when they had jawar, their glucose spiked. Nachni or like ragi, people are told ragi is a superfood for diabetes. Have you ever checked your glucose? It has as much carb as rice, but people are eating ragi as though it's free. But so they're not checking.
Right.
So I think whenever you're trying to see what a food is doing to give a quick improvement in your glucose, you have to do the pre and post. Without data, you'll just flying blind. And the sort of philosophical advice here is, let's say I have diabetes and I take food X, and today my glucose went up because of this food X. This is April 2025. I will come back to that food in 6 months, invest in repairing my body with other things like the sleep, the stress management, the muscle building. So the muscle will pull the glucose. If I have to fast and burn some belly fat and then come back to that food, same exact food. It's not the food here, it's my ability to handle. And then see, and it's very possible that we've actually made progress and it's not spiking me the way it used to. So we have to make sure that we keep it as a work in progress.
Right. And for someone with sugar cravings at night, what's the most effective way to manage or prevent them?
Start your day with protein.
Protein, yeah.
So protein, and then tell me what cravings you have left.
Okay. How can someone design a diabetes-friendly Indian plate without overcomplicating it?
So plan your protein. So your kitchen will have to run around what's the protein at breakfast, lunch, and dinner. And within an existing running Indian kitchen, it could be that, let's say there are 4 family members and the kitchen is already running. You may not change the entire menu, but you would change the ratio of how much is cooked for you of the protein source and of the vegetable source. And you can dial down on the carbohydrate source.
Okay.
So that doesn't require a menu change actually. Protein, veg, carb, or you do vegetable, protein, and then carb. Both of those will give a better glucose than if you start with the carb.
Okay. And also the portion size of the carbohydrates is naturally going down because I'm eating these two first.
Because I'm full.
Correct. And what's your go-to formula for planning a hormone-friendly breakfast?
So hormones, see the word hormone we use, sometimes we think of the estrogen, the progesterone, like the female hormones or the thyroid hormone. A lot of times people think their weight gain, for example. They say it's hormonal, and I'm being the hormone doctor, I'm sitting there myth busting a lot of times that most of the times it's not your female hormones or your thyroid hormone that's causing the weight, it's insulin.
Okay.
Insulin is most often the weight gain hormone that we need to talk about. So same, to have low insulin levels, again, protein focused breakfast. 30 grams of protein. What is 30 grams of protein? That's about 5 big eggs with the yolks.
Okay.
Or it could be about like 150 to 170 grams of paneer. Or it is a whole box of tofu. Or it is a chilla, like a besan chilla, in which you have added some pea protein supplement and some maybe soy protein flour. And if you're okay with eggs, you put eggs, or you put some cheese on top of it. So you'll have to track to make sure you're getting about 25 to 30 grams of protein in the morning.
All right. Now I'm going to ask you a bunch of questions. You just tell me if it is truth or myth. Paneer is bad for cholesterol.
Myth.
Diabetics should avoid all fruits.
Myth.
Eating rice causes diabetes.
It's not one thing that causes, because diabetes is many things. But rice will raise the glucose, yes.
Intermittent fasting is dangerous for people with thyroid issues.
Not under medical supervision.
Eating fat makes you fat.
Myth.
Sugar-free products are safe for people with diabetes.
Myth, I'm going to say.
Okay. You should stop eating carbs completely if you're diabetic.
Myth.
Protein can spike your insulin levels.
True.
And hormonal weight gain is impossible to reverse.
Myth.
Birth control pills regulate hormones.
They block your hormones.
Once you start insulin, you can't stop.
Depends on your C-peptide test.
Okay, if the pancreas can. Oh my God, I'm speaking like a doctor right now. It's so interesting. I'm telling you, you articulate it so beautifully well. Diabetes is a progressive disease. It only gets worse.
If you don't manage it.
Medication is the only reliable way to manage chronic illness.
Myth.
You need more willpower to heal.
Myth.
Emotional trauma can affect blood sugar levels.
True.
Overeating is just a lack of discipline.
Myth.
Lifestyle change only works if you're 100% perfect.
Myth.
Cravings are purely physical.
Myth.
All right. So, if there is one final advice that you can give to all the listeners, what would that be?
You're worth it. And you don't deserve or have to be sick. You don't have to suffer. And you deserve to be happy. So I hope you find that within.
It's so lovely that you spoke nothing about food or eating or anything, but it all comes down to the basics because if you truly understand that you're worthy, you'll make the right choices for you. And the very reason that we self sabotage our own success, our own health, comes from a place where we don't believe we're deserving of that kind of success. It's so beautiful. It's such a brilliant conversation, Roshni, because first of all, it's extremely rare for me to find a doctor who understands the emotional healing aspects of it. You having gone through a similar journey yourself and understanding the spiritual elements of it and speaking so openly, and it comes from a space of empowerment rather than telling, hey, do this, it works for you. Thank you so much. This was such a brilliant conversation.
Thank you.
I had a fabulous time.
Same. Thanks for having me.